We know that when women do better, families do better, and our nation prospers.
The National Partnership for Women and Families uses the power of partnership to turn promise into progress. Leading a coalition of nearly 150 groups, we helped expand the Family and Medical Leave Act, providing up to 6 months of unpaid leave to the families of wounded military service members. We worked hand in hand with local groups, convincing the District of Columbia to become the second city to guarantee paid sick days. We worked with local advocates to make New Jersey the third state to adopt paid family leave.
These victories are so important because they're building momentum for the broader work-family agenda. Working families are working harder than ever before, and they need time off to care for their own health or the well-being of their families.
We helped win a new law that ensures that people can take advantage of breakthroughs in genetic research without worrying about discrimination. But there's still work to do. The National Partnership won't rest until the victims of pay discrimination can once again get justice from the courts. That's why we're fighting to pass the Lilly Ledbetter Fair Pay Act.
When an employer decides to pay somebody less because of discrimination, they deserve to be accountable for that. The Supreme Court took that away, but we're going to give it back to them because that's what people deserve and that's what the law requires.
We're fighting to pass the Healthy Families Act so every worker will have paid sick days.
It's really unconscionable that day after day, millions of parents have to make the tough decision of what to do when their child is sick. For so many families in today's economy, every dollar counts. Every penny is important. They can't afford to lose a paycheck.
We're working to reverse the appalling increase in pregnancy discrimination cases and win paid leave and family-friendly policies for every worker.
We really need as a nation to face this challenge because our workplace policies are out of sync with the realities of working families' lives.
We're working in Congress, states, and local communities to change our healthcare system. We need real reform that guarantees that every person has access to high-quality, comprehensive, affordable care. We're helping to build a groundswell of support for comprehensive healthcare reform.
Healthcare reform is not just about giving everybody an insurance card. Behind that insurance card needs to be benefits that are meaningful, care that is high quality, the best in the world, and premiums that are affordable for all families.
We're using the power of partnership to enlist elected leaders from across the political spectrum, allies and activists, corporations and communities to make life better for women and families.
We are going to build momentum. We are going to keep at this until we make it happen.
We cannot do it alone. Partner with us today and help us realize a better tomorrow.
We need the power of partnership to turn this promise into progress.